So we're going to talk about shoulder movement today. A lot of people experience shoulder pain at some point in their life. Shoulder pain can come from all sorts of areas around here. The shoulder's a funny joint. It's like a ball and socket joint, a bit like your hips. So your hips are a really big stable joint and the body weight holds it together, and there's lots of muscles and ligaments around there that keep it nice and stable. Your shoulder is a ball and socket as well, but the ball of the socket of the shoulder is like a shelf, and your arm sits up. So this is the arm coming up into the shoulder here. So if there were no muscles coming down around this area here, your arm would pretty much fall off onto the ground. So it's it needs to be unstable to create all the rotation and the movements of the shoulder, but it also means that it needs a lot of support in there to hold it in place. So the muscles that wrap around here, excuse me, and suck the shoulder up into the joint. So there's a tension there all the time. Your shoulder muscles never rest, ever. Even if you're lying flat on your back, the muscles across the front of your shoulder here have to hold the arm in place. If you're lying on your side and your arms across in the front, the muscles across the back have to hold the shoulder in place. When you're sitting upright, the muscles from the top of the neck come down here, support the top of the shoulder, and then other muscles wrap around and suck the arm up into the joint. So there's always tension there. It's a very fine balance in the actual movement of the shoulder. If you take the arm forward and up slowly, as high as you can, you can see how all these muscles come into play. At the top, the arm's restricted by the end of the joint range. Again, if somebody was to force the arm backwards, you could get more range, but this is the position that an awful lot of people dislocate in when they're playing sport. Bring the arm back down again. You can also see how the shoulder blade moves at the same time. And this is very important, especially as you're moving the arm out to the side. Again, if you just like to bring your arm out to the side. Okay. And again, you can see the shoulder blade slides round and up to allow the whole shoulder to move properly. Okay, come back down again. One of the most common things we see is what we call a frozen shoulder. And there's various levels of this. It can be from a grade 1 up to grade 5, where grade 1 is a slight restriction in movement, and grade 5 is when you can hardly move the arm away from the side at all. Severely restricted. There's a few causes for this. It can be after an injury, where the body heals up and spreads too much soft tissue, healing tissue around the joint and gums it up, and the muscles get all out of balance and don't work properly. Or the body can just have an immune response where it tightens the whole shoulder up over time, and it can last up to 18 months. So many people come in for physio expecting 2 or 3 weeks later to be better, but on average, from start of the problem to the end, it's roughly 18 months. One of the main things that people do when they have frozen shoulder that's wrong is they try to increase the quantity of the movement, so the range of movement of the arm, by working the wrong muscles. So as I bring the arm out to the side, you can see this muscle here is reasonably relaxed. The muscles on the outside of the shoulder, the deltoid, are working hard. When your arm gets to about 90 degrees, then the muscles across the top of the shoulder here kick in, and that allows the arm to raise up through to the end of range. And you see this big muscle here is working hard to keep the muscle right up at the top. As the arm comes back down again, these muscles feed slowly out to allow the arm to come down to position. This muscle more or less switches off, and these muscles here allow the arm to roll down to the side. In frozen shoulder, generally the arm gets stuck round about this area here. So obviously you've lost that range of movement, and your brain wants to help you get the range of movement, so it starts to overuse this muscle here hugely, and you start to hitch the whole shoulder up, which is what we call elevation. Okay, and also the body, as the subject's doing here, tends to hitch to the side. So this thing that you can see creates problems down this side of the body, into the opposite side of the back, up into the neck on both sides, and relax back down again. So frozen shoulder not only affects the shoulder, it also affects the neck, the thoracic spine, lumbar spine on the opposite side. If you keep going with these trick movements, as we call them, over a long period of time, then it can create all sorts of issues all around the back that are not associated with the shoulder as such, but as a result. So folk who have the frozen shoulder then don't understand why they get problems elsewhere. It's because of all the compensations that go on here and pull the body out of alignment. So if we're going to correct this, and again the results aren't quick, but it just needs patience, so it's the quality of the movement that's important, not the quantity. If you're going to bring the arm up to the point where it starts to what we call hitch up or elevate, we just like to elevate your shoulders. So there's the trick movement coming in, you bring the arm back down. The shoulder blade's the most important component here. I need to concentrate on this bottom corner. You need to concentrate on keeping your shoulder blade very gently pulled down, as if there's a little bit of string going from the shoulder blade towards the opposite pocket. So you concentrate on keeping that shoulder down You lift the arm up until you felt the hitch or the elevation coming on. About there, you would stop, concentrate on this control here, and then roll the arm back down. Trying to keep this muscle here as relaxed as possible. Remembering that as the arm comes out to the side, this muscle doesn't actually really become too active until the arm's up at 90 degrees. So if you're using it from here, all you're going to do is make the shoulder tighter and tighter and tighter. And that's why people start with a little bit of loss of movement here, and over time it gets less and less and less. And there are people who cannot move the arm from the side at all and just side bend their whole body, and they're stuck there completely. It's very hard to get away from this. So quality, as I said, with movement is much more important than quantity. Don't try and force the shoulder into the end range. Gentle stretching and concentrating on working the muscles properly are going to be the key. Go and see a qualified physio to give you the exact exercises rather than just carrying on yourself, but those are the main causes.